Research shows the coronavirus pandemic could continue to negatively impact emergency healthcare workers for years to come. A recent ProPublica investigation found many EMTs don't often have the proper funding or resources to perform their jobs, even before the pandemic. COVID-19 only added to that strain, forcing many to take unprecedented measures to respond to the crisis. This includes working for 48 hours, taking on extra shifts for colleagues infected with COVID, and attending to large groups of patients at once. For more, let's bring in Dr. Wendy Dickinson. She is a clinical psychologist and stress management expert. Doctor, thanks very much for being with us. So frontline healthcare workers have been dealing with a surge in patients, as well as, in many cases, a level of death that many of them might not be used to seeing before this time. How has all of this been impacting their mental health, and could they face long-lasting psychological effects?
We absolutely know that it has been impacting their mental health. The level of stress that the frontline workers are under is astronomical. And what we know is that stress over time becomes crisis, and crisis over time results in trauma. And so there will be long-lasting effects if people aren't able to find ways to take care of themselves, to be able to have a break, and then really begin to refuel and heal from the trauma that they've experienced.
Yeah, what should first responders and their families be doing to try to deal with this stress and trauma?
I think one of the most important things to remember is that when we're dealing with stress, we can either decrease the stressor or we can increase the coping resources that we have to manage the stress. So the good things that we have to fill ourselves back up and to heal after we've been through something really stressful. In this particular situation, some of those stressors are outside of our control, right? And so we can't always decrease those stressors, but we can work on increasing the good things. And I think, those are going to be different for each person, but people need a break. They need to be able to disconnect from work. They need to be able to have some relief and go on vacation, even if it's just to stay at home and spend some time with their family. One of the things that I'm seeing with my client is that people are in a kind of chronic state of disconnection. They're sort of in a rut around staying at home and staying disconnected. And it's really important to start to re-engage with relationships, because relationships are one of the things that helps insulate us from the negative effects of trauma.
Yeah, I wonder if you could talk about that a little bit more, Doctor, because, you don't necessarily have to be a frontline worker, although they, of course, are experiencing this so acutely in a different way. But many people right now are feeling this sort of pandemic burnout. And, I wonder if you can explain a bit more about that phenomenon from a psychological standpoint.
Sure. So burnout in general is characterized by extreme fatigue. So it's not just being tired. It goes far beyond that. It's a deep level of exhaustion on an emotional, a physical, and a mental level. It can result in hopelessness, depression, irritability, even in physical pain. So the thing that we know about burnout is it can be really significant in someone's life. What's unique about pandemic burnout are a couple of things. One being that it's pervasive. We are experiencing symptoms of burnout across all levels, across social levels, across work levels. Even basic things like when we go to the grocery store, everything is changed and it's different. The other thing that I think is really unique is that sense of isolation that we have. I was talking about that a moment ago with the relationships. We have done so much of the pandemic in isolation that disconnection itself can lead to burnout. And so I think that's where connecting with some help, if you're feeling these symptoms of burnout, finding a therapist that can support you, getting somebody professional on your team to help you figure out how to increase those good things or maybe decrease some of the stressors that you can becomes really important.
And finally, Doctor, what would be your advice to people who are hearing about the potential for things returning to quote unquote normal, although that's something that is a relative term these days, but just feeling a sense of anxiety about what that might entail as they, have in many cases sort of gotten used to, for better or for worse, this existence that we're in, where, as you say, a lot of folks are disconnected. Nevertheless, the idea of reconnecting for some folks is a lot to deal with.
Yeah, I think you're right. I think a lot of people are looking forward to it and they're going to kind of bounce back into life and look for a sense of normalcy. And I think that there are other people that are going to be surprised at how difficult it is to re-engage with life on a somewhat normal level. And part of that is because we've been talking for a year about all the scary things about doing normal stuff, and it's going to be hard to downshift. The other piece of it is people who already struggle with mental health issues, anxiety, depression, OCD. We're seeing an intensification in their symptomology, in the way that they're experiencing those mental health issues. And so again, I think it's really important to know that you're not alone. Know that there are people out there who can help you, and trained therapists who can come alongside you and help you re-engage with life in a way that might feel scary, but helps you overcome it and to be the best version of yourself that you can be.
Such an important message, Dr. Wendy Dickinson. Doctor, thank you very much.
Thanks for having me.